Dr. T.
Yeah, what's up?
I've heard a lot about the vagus nerve. How does that or can that affect my child's health?
Oh, yeah, in so many ways. The vagus nerve is probably one of the most important nerves in each of us, and especially kiddos, because it plays such an integral role on so many different areas of the body. So yes, it can. For sure.
So we're seeing a lot, according to the CDC, of health conditions that are affecting about 40% of children in America.
Yeah, chronic health, right?
Yeah.
So much.
Where is that coming from, or how does that affect?
Right, like, a lot of answers are kind of searching like, oh, it's our food supply, it's this and that, and yeah, it's oftentimes an accumulation things. But what it really comes down to is our, any health effect on our body where it's not performing well. It's just our body not able to adapt to the environment. In and around it. And so it's oftentimes that there's so many things that are just overloading our systems that they're creating a shift within it and really pushing our kiddos more into out of the healthful state, which is the parasympathetic, and driving it to be more in that sympathetic state, which is that fight-flight system.
Okay.
And so if we're more in that and not as much in health, you get what you get. You can't adapt well.
So you obviously talk a lot about the vagus nerve here. What exactly is it?
It is, it's called the vagus nerve, not like Las Vegas, but the vagus, V-A-G-U-S. A great term that meaning it's the wandering nerve, and they call it the wandering nerve because it extends. It's the only cranial nerve that exits the skull, and it wanders through the neck, and it connects. It's one of the biggest brain-gut connectors.
Okay.
It connects the heart, the lungs, upper third of digestional tract. Really, it just really connects the brain to the body in so many different ways, why it's so important too.
Okay.
And it's one of the biggest players in that parasympathetic, that rest and digest system.
So if there is vagus nerve dysfunction, how can that impact my child, and where exactly does that start? Yeah,
so it impacts. So if you think about it, like I try to keep it simple, where like the vagus nerve and the parasympathetic, it's like the brake pedal. It's that common ease side of the system. And so if we've got so many different factors that are causing the system to get in more protection, and those factors can be like, yes, where is it coming from? It can basically physical, chemical, and emotional stress, but this can go back to even maternal stress in when little ones are in utero, because maternal stress hormones cross placenta, and can affect their birth process, big one. A lot of physical demand and stress, particularly in the neck area, especially if there's Pitocin, induction, forceps, vacuum, C-sections, the buildup of if they need interventions with antibiotics early in life and repeated interventions throughout, if their immune system's affected. And all of these factors can come into play to trigger the system to be more in that protection side. Okay. And so if the gas pedal gets to be stronger and our brake pedal is weaker because it's interfered with, this is how interruption in that vagus nerve can impact our overall health, because the system's not focusing on health.
Right. So how can I check to see if my child has that vagus nerve dysfunction?
There's not an easy way to do it from like just seeing, because you can't see it from the outside, unless it's gotten to a point to where it may be expressing some of those symptoms. But the easiest way, particularly why we've invested, is in the technology, the insight scans that we use. So it allows us to gain this objective information about the nervous system in different ways that is non-invasive. It's easy to do and gives us a lot more information about the individual that you just can't see from the outside.
Okay, so like a look behind the curtains.
A look behind the curtains, under the hood, right? Yeah, those things that you just can't see on the outside.
Awesome, thank you.